Hello students, this is Mr. Phelps again with Job Corps in Simpsonville, Kentucky. And today we're going to show you about doing injections, and also we're going to show you about phlebotomy. So Dr. Smith has ordered from Mr. Short here a flu vaccine. So we're going to do the flu vaccine, then we're going to do the blood draw. Let's get started. Hey Ms. Short, it's good to see you again.
Hello.
Hi. So Dr. Smith ordered a flu shot for you, and you've already filled out your consent form. We already got you your vaccine information sheet. So we'll get you started with the flu shot. Is that okay?
Yes,
Can I use your left arm or right arm?
whichever you prefer.
Thank you. We'll go with the left arm. Okay. So first thing I do before anything, I'm gonna clean my hands. So with most vaccines, there should be a pre-filled syringe, but just in case it's not, we're gonna draw up the solution. So first, we're gonna make sure we have the right solution, and then we're also gonna make sure that it's not expired. Because the last thing you want to do is inject an expired medication into a patient, because that's not going to be good. Now, before we get started with drawing this up, we're going to get an alcohol wipe. We're going to wipe off the top to ensure that we're not transferring any bacteria or germs. We'll take the cap off. We're going to stick the needle down into the top, and then we're going to rotate it up, and we're drawing up 1 ml of solution. So what I normally do is draw up more than 1 ml, and then to help get rid of bubbles, I flick it like that, and then I push the plunger until I get to 1 ml. That way I know for certain that I have little to no bubbles and I have the right amount of solution. Now, for the sake of this video, I'm going to put the safety lock on it because we're not actually going to insert the needle, but I'll show you how to do it. Okay. I'm gonna roll this up. If the patient's wearing short sleeves, the best thing to do is take the sleeve and tuck it under. That way they don't have to hold it, but it stays in place. We're gonna get our gloves and our Band-Aid and alcohol. Make sure that you have proper fitting gloves. If your office doesn't have proper fitting gloves, request them. They have to give them to you. Okay. By the way, you're not prone to fainting or passing out, are you?
No.
Very good. Now, if the patient says that they are prone to fainting or passing out, the best thing to do is have them lie down, okay? If at any point the patient says stop or pause or discontinue, you have to stop. Nothing happens without the patient's consent. First thing we'll do is take the alcohol wipe, and we're gonna clean the deltoid. The deltoid's here, the biceps here, the triceps here. We're gonna clean the deltoid. Now, for the sake of convenience, we're going to take this Band-Aid, peel off 1/2 of the seal, and we're going to stick that on the glove. Because when I'm done with the injection, instead of having to rotate and reach for my Band-Aid, it's going to be right on my left hand. Okay, so as I said, for the sake of this video, we're not actually going to inject this solution, but I'm going to show you how. Ms. Short, can you have your left arm hang to the side and go limp? Act like it's not even there.
Okay.
What I do is I take my thumb and I press into the middle of the deltoid. Then I take my other 4 fingers and I kind of grip the shoulder. So I'll take my thumb and I'll press and then lift, like I'm trying to scrape a sticker off her arm. Next, what I'll do is I'll hold my thumb there for about 5 or 6 seconds. I'll aim the needle a few centimeters underneath my thumb. And by the time I'm ready to let go, instead of pushing the needle in, I let go of the muscle so that the muscle reinflates over the needle. Now you can push the needle in, but what I've found in my experience is to make it less painful is you let go of the muscle so they don't actually feel the pressure of the needle going in because the muscle just reinflates over it. And then you peel off your Band-Aid, place it on there securely. Now after injections are done, you want your patient to wait in the exam room or in the lobby for about 5 minutes before they leave, for the simple reason. If they were to have a bad reaction, you'd rather be in the office with you and the doctors so that she can receive accurate help instead of being out there in the world where somebody may not know what to do for her. So you definitely want to have the patients stand back and wait for about 5 minutes. And that's the end of the video.